Hello everyone, so we can start the session of Cadaveric Images Session, which was the part 9. So yeah, let me know whether you can hear me and is the screen clear so that we can start the session. Yeah. So before starting the session, I would like to give you a brief introduction about the platform and about myself. Myself, Dr. Monalisa, and I have done my MD Anatomy from Armed Force Medical College, Pune. And I have got a past of 8 years of teaching experience. So let's start with the session. This is the code. This is ANAT 10 is my code, which can be used by you if you want to take the plus subscription or you want to see the free sessions on the platform of Unacademy. Okay. Now I also want you to know about the Let's Crack NEET PG Telegram group. So you can join this group and you can get the updates of all the free sessions on the platform of Unacademy. Along with it, you can also be the there are many educators on the platform, so you can clear your doubts. You can ask your doubts in this. So that would be very important. So now I just want you to know that you can get the link of all the sessions. Okay. So all the information of the special sessions, all the information of upcoming plus sessions, all this is provided in this group. So do join, it will be highly beneficial. Now, ask a doubt. So for that, what you have to do, you have to click on ask a doubt on the screen, then take a picture or choose from the gallery, then crop the image, highlight the specific question, select the question up to the subject to which the question belongs. So this is how you can ask a doubt. So I also want to tell how you can access the free sessions on the Unacademy platform. So for that, what you have to do, you have firstly to download the Unacademy app from the Play Store, then find your goal as NEET PG. So you will find your goal as NEET PG, and what happens there after, you can just type my name, Dr. Monalisa, and you can find the session. So you can find the free session link there, and there you can just join my session. Also on the Telegram group of Let's Crack NEET PG, there is the link provided of my upcoming sessions. All the educators, 19 subject educators, upcoming sessions link is provided there, also for the special sessions and also for the YouTube sessions, and also information about the plus course which is coming up on the platform of Unacademy. So if you want to be the part of free sessions on the Unacademy platform, what you can do, you can use an unlock code. If you are using, if you are downloading the app for the first time and you want to see the free session, then you have to use the code ANAT10. So this code can be used by you and as an unlock code, and that is the ANAT10, and then you can be able to access the free sessions on the platform of Unacademy. Now my dear aspirants, Unacademy, there is 200 MCQs NEET PG series, 200 anatomy MCQs NEET PG series which I have started. So today 21st, that is Saturday, August. So we have already covered up 150 MCQs of anatomy, which is very important for your examination. But I want you to also join today. This is in this session again we are covering up the few more MCQs. So I will try to cover as much as MCQs I can do. So you join me at 6 PM and 7:30 PM today. Okay, so those students who are just seeing the session for the first time, they should download the Unacademy app and use this as an unlock code ANAT10. So please note down the timing, 6 PM and 7:30 PM. This is the 200 anatomy MCQ session 11th and 12th. Don't miss out, it is highly beneficial for you. Now, I would also like to tell you about the special class features and what are they, which is highly beneficial for you and which is absolutely free. So it's an interactive session. That means you can ask your doubts live in the platform when you are attending the session. Live interaction is possible on the Unacademy platform, and it will give you a face-to-face classroom like feeling, and it is quite beneficial also. Polls are conducted. So whenever an educator take a session, they will go for MCQ series or any revision kind of session. So they will conduct a poll. So in that, students can participate, and what is the usefulness of this is that you will have a healthy competition among the other learners. So polls are conducted. You can raise your hand and ask a doubt while the live sessions is going on. So this is also highly beneficial for the students. Never miss a class. What happens, for example, if you have seen my session and you are following me, you started following me on the Unacademy app. So you are not able to miss any of the session, because always Unacademy give you notification of all the sessions which is taking place on the platform of Unacademy, whether it is on the free platform or plus platform. So lecture notes are provided to you. Now what happens after the finishing of a session, you can download the app and you can get the PDF of the notes anywhere, anytime. You can study from at your own ease. So these are the benefits of special class features which is present on the Unacademy platform. So don't miss any of the session, it is highly beneficial. You can follow me for the updates of all my free session. Links are provided on the Telegram group of Let's Crack NEET PG. Okay. Now I also want you to tell about subscribe, like. So you should just subscribe and you should like and share the YouTube session channel, that is Let's Crack NEET PG. And I also want to tell that referral code of mine. So mine referral code is NAT10. So this referral code, which is called as NAT10, can be used by you. And this, if you use this code, you can get 10% discount if you take the subscription of Unacademy. So 10% discount can be availed by you if you are using this code NAT10. Okay, not only for the Unacademy Plus subscription, but also for the Iconic subscription. Before starting the session, I would also like to tell you about the Bucks Bounty. What is Bucks Bounty? This is the opportunity which is given. This is the in this you get an opportunity. The learners get an opportunity. If any inappropriate content or anything inappropriate is provided in the video by the educator, you can report it, and if you are forced to report it, you can claim your prize. So this is how it's very beneficial for the learners. So let's start with the session now. So I would start the session with the first MCQ of today's session. So all of you, please mark the answer. What is A, B, C and D marked in the image? So all the best to everyone. And just mark what is A, B, C and D. Okay, I will give you 30 seconds, otherwise I will come up with the explanation. So what is A, what is B, what is C and D? Okay, A, B, C and D. Try. If you are not able to answer, don't worry, I will give a proper explanation. So you have to just tell me the structures marked A, B, C and D. Okay. So your time begins now. I would like to slightly highlight it so that you can understand. Yeah, so I have just highlighted it. I have just enlarged the diagram. What is A, what is B, what is C and D? Okay. So actually here we can see the layers of abdominal wall from the anterior aspect, which has been dissected out, and the layers is highly visible here clearly. And if I want to tell that D layer is the layer which is lying just adjacent to peritoneum. Okay, so here D is, if we talk about the D layer, so this D layer is fascia transversalis. Okay, this is transversalis fascia. This is transversalis fascia. Don't worry, I will again take this fresh image and explain it to you. And if we talk about this green color structure, which is B, and this is what? This is conjoint tendon, which is formed by the fusion of transverse abdominis and internal oblique muscle. These are the femoral vessels and this is femoral artery. Okay, this is the femoral artery. C is superficial inguinal ring. Superficial inguinal ring, which is an triangular opening in the external oblique muscle aponeurosis. Okay, so let's see this diagram in fresh. I have already written what is A, B, C and D, but I would like to enlarge this diagram and let you know what are the layers in a sequential wise, so that you can know each and every structures which is visible in this diagram. Okay, so yes, let's start with that. Okay. Okay, so now coming up with the explanation. So let me enlarge. So I would like to use black color here. Yeah. So actually these, in this diagram, what you can see here, the layers of abdominal wall as we see from anterior aspect. So the most superficial layer, this is external oblique muscle aponeurosis. This will be internal oblique muscle aponeurosis. This is transverse abdominis muscle. This is the transversalis fascia. This is transversalis fascia. And the most innermost layer, this is the peritoneum. This is the anterior abdominal wall layers. This structure is the green color is the conjoined tendon, and clearly you can see here this conjoined tendon, let me use, this conjoined tendon is formed by joining of two muscles, that is transversalis aponeurosis and internal oblique muscle. Okay. Other than that, you can see here, this is the femoral vein and femoral artery and femoral vein. You will also see here the opening, that is superficial inguinal ring is seen here. So, this is superficial inguinal ring opening. This is the superficial inguinal ring opening. So, these are the important structure which is clearly visualized, and with no doubt we can clearly mark it right. Now, let us move on to the next one. Okay, so this is the second MCQ. So, all of you do mark the correct answer. So, all of the following statement is correct about the marked image except. Okay, so question number 2, all of the following are correct about the marked muscle in the image except. So, we have got 4 options. Action A is action of this marked muscle is elevation of thoracic rib cage. B is origin from the posterior border of iliac crest. C is insertion into the inferior border of 12th rib L1, L2, L3, L4 and L5. And D is nerve supply is by 12th thoracic and the ventral rami of lumbar nerves. So, according to you, which is the incorrect one? Okay, according to you, which is the incorrect? All of the following are correct about the marked structure in the image except. So, you can see there is an black arrow I have used of on a muscle. So, you have to firstly identify this muscle and you have to mark which is a wrong statement about this muscle. So, again I will give you 30 seconds to mark it, otherwise I will again explain this. So, your time starts now. Okay. Okay, which is the incorrect statement? So, yes, waiting for your answers. Actually, in this question, first thing is that you have to identify the muscle. So, this muscle is, as you can clearly see, this is the muscle which is clearly seen. So, for like this only, I have included another diagram in which you were clearly seen. So, firstly try to identify the muscle and then mark the correct answer. So, here we can see this is actually posterior approach. This is the posterior approach for the kidney, and the arrow marked structure is Quadratus Lumborum. Okay, Quadratus Lumborum is the arrow marked structure. So, this is QL I will write, and the incorrect option is A, that is action is elevation of thoracic rib cage. Actually, it is not elevating the thoracic rib cage, it is depressing the thoracic cage. So, I will come to it. Before that, I just want to identify the structures which is seen here. So, let me slightly highlight this diagram. So, yes, now if you will see, this muscle is external oblique muscle as we are approaching from posterior aspect. Then we have got inside internal oblique muscle, and these are the transverse abdominis muscle, aponeurosis also. Here we can see this is the LD latissimus dorsi muscle, because this is 12th rib. So, we are clearly seeing 12th rib close to it, which nerve is lying this is subcostal nerve, and lower to it will be the iliohypogastric nerve, root value L1. Now, my dear aspirants, this muscle which you are seeing is Quadratus Lumborum muscle, which was asked in the image, and you have to clearly know all the important points: origin, insertion, nerve supply and action of quadratus lumborum muscle very clearly. Also a part of erector spinae muscle can be seen, that is the muscles of back on the medial aspect. So this is erector spinae muscle. This is erector spinae muscle which is seen. Okay, and here we can see the kidney has been approached. So this is the kidney which has been approached from the posterior aspect and which is covered by this perinephric fat. Perinephric fat which is covering it. This will be serratus posterior inferior muscle. Serratus posterior inferior muscle. So we have identify all the muscle which is seen in this image. Other than that, what is important is to know that what are the origin, insertion, action of quadratus lumborum muscle. Now I would like to show this diagram to you. Here you can clearly see the quadratus lumborum muscle. See here. So this is the quadratus lumborum muscle which is clearly visible in this diagram. And what you can appreciate that this muscle is originating from the posterior border of iliac crest. What you can appreciate that this muscle is originating from posterior border of iliac crest. So this is what, this is the iliac crest. Okay, so this is the iliac crest, and from the posterior border of iliac crest it is originating, inserting into 12th rib and L1, L2, L4 and L5. Can you see here, these are the lumbar vertebrae. Okay, so this is the L1, L2, L3, L4, L5 and also onto the 12th rib it is inserting. So insertion point is on the 12th rib and L1, L2, L3 and L4 lumbar vertebra. Arterial supply is lumbar artery, lumbar branch of iliolumbar artery, yeah, and also the nerve supply is 12th rib and through nerve fibers of L1, L2, L3 and L4. Action. So this was marked as a wrong option. Why? Because let me see about the action. So when we are talking about action, unilateral contraction will cause lateral flexion of vertebral column and bilateral contraction will cause depression of thoracic rib cage, will lead to depression of thoracic rib cage. So this is the action. Okay. When there is bilateral contraction, it will cause depression of thoracic rib cage, and when it is unilateral, then it will cause lateral flexion of vertebral column. Got it, everyone? Let's move on to next MCQ, that is MCQ number 3. Okay. So all of the following statement is true regarding this cadaveric image shown in the diagram. So firstly you have to identify the image here. Firstly you have to identify the cadaveric image here and you have to tell me which of the following is wrong statement. Which of the following is wrong. So question number 3, whether it is adductors or whether it is adductor of arm or humerus, the marked muscle. Arterial supply is subscapular circumflex, lateral rotator of the humerus or supplied by lower subscapular nerve. So firstly identify it, identify the muscle and then tell me what is the true statement regarding this. So your time begins now. All of the following are true statement regarding the mark structure in the image except. So firstly identify the arrow mark structure and you have to tell me which of the following is the wrong statement. Your time begins now. So my dear aspirants, the wrong statement for question number 3 is that lateral rotation of humerus. Actually, what is the marked muscle? The marked muscle is teres major muscle. What is it? It is teres major muscle. So how we are going to identify? We are going to identify this muscle because you can see 3 muscles are going towards the greater trochanter of the, it is going towards the greater tubercle of humerus, and we know that greater and lesser tubercle of humerus has got the insertion of rotator cuff muscle. So these are sits muscle. Okay, lowermost is the teres major muscle. Sits means supraspinatus. So this will be supraspinatus S, infraspinatus I, and this will be teres minor muscle TM. Don't worry, I will again show you another diagram where you can clearly identify it. So again, it is not lateral rotator. Teres major muscle, which is the arrow mark structure. So it is not the lateral rotator, it is causing adduction and internal rotation. So let me just highlight this diagram. So when I am highlighting it, clearly what I have included 2 images. So this is the muscles which is clearly identified here. Okay, so this was muscle which was asked. So this is teres major muscle. So here also this will be teres major muscle. Now here what you can see, this is the long head of triceps. So corresponding to this, this will be long head of triceps. Now this is supraspinatus. This is supraspinatus muscle. This is infraspinatus. This is infraspinatus, and this is teres minor muscle. Rotator cuff muscle sits, these are, and anteriorly where there will be subscapular muscle. So here this is also supraspinatus, this is infraspinatus, and this is the teres minor muscle. Okay. So done with this. This is all about the identification, which is clearly identify. Actually they are coming up in this image, they are quadrangular spaces and all has been seen. So we have done the spaces as seen from the posterior aspect. So yes, clearly we can see here the boundaries and we are able to identify the muscle. The muscle is teres major muscle. So let me tell you about the teres major muscle details. So when we talk about teres major muscle, its origin is from the posterior aspect of the near the inferior angle of the scapula. Insertion occurs into the medial lip of intertubercular sulcus of the humerus. On the lateral lip, the pectoralis major muscle inserts, and when we talk about arterial supply, it is from subscapular and circumflex scapular. Subscapular and its branches circumflex scapular. These are the branches from third part of axillary artery. Nerve supply is lower subscapular, having the root value C5 and C6. It's a branch of posterior coda brachial plexus. When we talk about the action, what was labeled here was the action was not correct. And when we talk about the action of the muscle, it adducts the humerus, it is causing internal rotation or medial rotation of humerus, and also extends the humerus from flexed position and depresses the shoulder. Most important function is it causes internal rotation and adduction of arm. So let's move on to the next MCQ, that is MCQ number 4. So you have to identify what is A, B and C in this image. You have to identify what is A, what is B and what is C in this image. What is A, what is B and what is C in the image. Got it? So mark your answer, otherwise I will come up with the explanation. A, B, C. What is A, B, C in this image? Okay. So here we can see that the hip bone is sewn. Here the hip bone has been sewn, and acetabular cavity is also opened up. Okay, what you can appreciate, the acetabular cavity is also opened up. So the structures which can be clearly, so first I want to tell that when we talk about A, so here A is iliofemoral ligament, B is rectus femoris muscle, and C is obturator artery. Now my dear aspirant, I would like to show you the same thing in this image. So let me just highlight this diagram. This was the image which has been asked. So here what happens, the structures which can be clearly visible here. Okay, so first thing is this muscle which you are seeing here. This is the gluteus maximus muscle. This is the gluteus maximus muscle which you are seeing. This is the gluteus muscle, gluteus minimus, sorry. This is the gluteus minimus. But we will concentrate now on the structure which has been asked. So this we have done. So this muscle is the gluteus muscle, gluteus minimus. Now as just above the acetabular cavity we can get two muscle. So let me just highlight it. The first here I am using green color, and you can see the two heads of the muscles has been joining to form the rectus femoris muscle. So this is the rectus femoris muscle. This muscle which you are seeing is the rectus femoris muscle, which is arising from the anterior inferior iliac spine and also from the area above the acetabular cavity. So, anterior inferior iliac spine says straight head, reflected head from the area above the acetabular cavity. Just below it you can see the part of the ligament which I want to show. So, this part. Okay, this was also asked, and we know that this is one of the strongest ligament in our body, and we know that just this ligament is also arising. This ligament is also arising from the anterior inferior iliac spine, and this is iliofemoral ligament. Which ligament? This is iliofemoral ligament. Now, my dear aspirants, we can clearly see this is the acetabular cavity. This part will be the round ligament of head of femur, which is arising, round ligament of head of femur, which is getting connected to fovea capitis, and merging with this fibers will be the transverse acetabular ligament. This will be transverse acetabular ligament. Now, my dear aspirants, this is obturator membrane, and what you can see here that above there is a gap in obturator membrane, and this artery will be obturator artery. This artery will be obturator artery. So, is it okay? All the important identification we have done in this image. All the important identification has been done, and we can clearly see these are the structures which is highlighted in this image. These are the structure which is highlighted in this image, and clearly we can see. Actually, we have to know the area that is lying above the acetabular cavities, and we get the landmark that the structure to be identified will be the structure lying close to it. Anterior inferior iliac spine से rectus femoris muscle का straight head origin होता है और iliofemoral ligament origin होता है. So that is the crux point, and a gap which is seen in the obturator membrane, that is obturator foramen, through which obturator artery is traversing. Let's move on to the next MCQ. So done with the question number 4, let's move on to question number 5. Which of the following is not supplying the marked structure of the heart? So we have got 4 arteries: right coronary artery, anterior interventricular artery, marginal artery and diagonal artery. So you have to tell me which of the following arteries is not giving blood supply to the marked area. Can you see arrow marked area is shown in the part of the heart? So you have to identify that area, and then you have to tell me which of the following arteries is not giving blood supply to this respective area. Okay, so mark your answer. Question number 5th. Mark your answers. Okay, the correct answer here will be diagonal artery. Why diagonal artery? The first thing is that the arrow marked area which is shown in this image is the right ventricle. Okay, so how we are, so this is right ventricle. Let me slightly enlarge this diagram. See here. Now what you can see here clearly, actually this is the part of superior vena cava, and this, so this will be clearly the right atrium. This is the apex, so this area will be the left ventricle, and in between on anterior aspect, the right atrium, left ventricle, this area which you are seeing here will be the right ventricle. Right ventricle means this is clearly shown that this area will be right ventricle, no doubt about this. Next, what is important, very important for, this is the right ventricle. Next, what is very important for us to know, the blood supply of the right ventricular area. So my dear aspirants, we have got the options as right coronary artery, anterior interventricular artery, marginal artery and diagonal artery. Got it? So we have got 4 options: right coronary, anterior interventricular, marginal or diagonal artery. So here we have got the diagonal artery is a branch of which artery? Diagonal artery is a branch of left coronary artery. Diagonal artery is a branch of left coronary artery. When we are talking about right coronary artery, anterior ventricular artery, so here we have got also the anterior interventricular artery is also the branch of LAD artery. Anterior interventricular artery is also called as left anterior descending artery, and it is also the branch of which artery? It's also the branch of left coronary artery. So it's also the branch of left coronary artery, and right, there is no doubt about, let me just tell you about this. We have no doubt about right coronary artery, and we have no doubt about the marginal artery. Why? Because marginal artery and right coronary artery. So here the marginal artery is a branch of right coronary artery. So these two arteries are definitely giving blood supply to the right ventricle, no doubt about it. We have got two coronary arteries, one is right coronary artery and other is the left coronary artery. So it is quite clear that these two arteries will give blood supply to the right part of the heart. So that is the right ventricle will definitely get blood supply from right coronary artery and its branch marginal artery. The doubt is in the left branch of the left coronary artery. So in this option we have got two arteries, one is anterior interventricular and diagonal artery. Actually anterior interventricular LAD artery is also giving blood supply to the part of right ventricle, but diagonal artery is not giving any kind of blood supply or any trace of blood supply to that of right ventricle. Diagonal artery is a branch of left coronary artery and its arterial supply is on the anterior and lateral portion of left ventricular wall. So write down this detail and then I will show you the branches also. So please write down this detail. Yeah, diagonal artery is branch of, diagonal artery is branch of left coronary artery. Diagonal artery is a branch of left coronary artery and it give blood supply to, anterolateral papillary muscles of left ventricle and anterior and also anterior and lateral portion of left ventricular wall. Got it everyone? Yes. Now let's move on to the branches. So let me show you the important branches. So my dear aspirants, you can clearly see this is the anterior view or sternocostal aspect of the heart, and important branches are right coronary artery and we have got other important branch is the left coronary artery. Okay, now we can see posterior descending branch, that is also called as posterior interventricular branch, marginal artery, all will give blood supply to that of, all will clearly give blood supply to that of right ventricle, no doubt about it. When we are talking about left coronary, two branches are there, one is the left anterior descending or anterior interventricular artery and other is the diagonal, but diagonal artery is only concentrated to the blood supply of left ventricle, it will not provide blood supply to the right ventricular part. So I think this is clear. So before ending this session, I would like to give you a quick recap of all the upcoming session of mine which is coming on the platform of Unacademy special platform, and then I will move up with the few important updates about the platform of Unacademy. So let's start with that. So download the Unacademy app. So if you want to see free sessions on the platform of Unacademy, what you have to do, you have to download the Unacademy app. So download the Unacademy app, find your goal as NEET PG. So then thereafter you will find your goal as NEET PG. And after that, what you have to do, after finding your goal as NEET PG, you have to type my name, Dr. Monalisa, and you have to search for the special free sessions on the platform of YouTube. And what will happen, then you will get the updates and the links of my free sessions on the platform of Unacademy. Use this code NAT10 to see the session as an unlock code. You can use this free sessions on the Unacademy platform. So the free sessions on the Unacademy platform is following. So for that, use the code NAT10, and I just want to give you the information. Today I am going to take 2 free sessions on the Unacademy platform. So that sessions are on 21st today, 21st August, that is Saturday. So today itself on Saturday I am taking 2 sessions. So one of it is at 6 p.m. and another is 7:30 p.m. So 2 sessions, 6 p.m. and 7:30 p.m. 2 sessions are there. 6 p.m. and 7:30 p.m. is there of 200 anatomy MCQs. Use the code NAT10 to unlock the session and be the part on the free session. So we have already covered up 150 MCQs, rest 50 MCQs are left, so we will cover up that also. And join me for the 2 special session, one at the 6 p.m. and another at 7:30 p.m. today itself. on the Unacademy platform. Those students new to the platform, what they can do, they can download the Unacademy app, find their goal as NEET PG. Thereafter, they can find Dr. Monalisa free session, use the code NAD10 and be the part of free sessions. Now, I also want to give you the information about the plus subscription of Unacademy. So we have already talked about the free platform of Unacademy. So it is also important for you to know about plus subscription and plus platform of Unacademy. My dear aspirants, when we are talking about the plus platform, what is it? You can avail the opportunity to access both the live and recorded version of Unacademy platform. So on Unacademy Plus platform, various live sessions are simultaneously running on the platform, and these sessions are all of 19 subject targeting, whether your target is FMG, whether your target is NEET PG, whether your target is INICT, University Prof exam, or your target is next. So simultaneously number of sessions are going on the platform. You can join any of this, and the entire 19 subject is completed with the latest approach, what is the latest pattern of the question being asked for the competitive exam. And my dear aspirants, if you will be not able to complete it, or at times you are, due to your academic load or due to your schedule, family and personal engagement, what can happen, you can also access and see the sessions at your ease at recorded version, and it is not limitation that 1 time, 2 time, 3 times, number of times you can see the session. Study on the device of your choice from your own place, whether it is laptop, mobile, iPad. So at your pace, just you have to have a good internet connection. Learn from India's top educators of the medical field. Get your doubts cleared in the live sessions. Every 4th session on the Plus platform is a doubt clearing session. Access more than 25,000 MCQs on the platform of Unacademy. So there is more than 25,000 special high yield MCQs on the platform of Unacademy, with a detailed effective explanation given to each and every MCQs. Complete live test and quizzes, compete with the other competitors, know where you are ranking. And soon what is coming up, it's a good news that what is coming up with 1 year subscription or plus subscription of Unacademy and more, you will get printed notes provided for the Unacademy study material. So that are all important points. Now let's move on to the iconic subscription. Adding on with the so iconic subscription. What is iconic subscription? What are the benefits of iconic subscription? When we are talking about the benefits of iconic subscription, what happens? The benefits of Unacademy and Prep Ladder both is added on. So according to, I have already talked about the benefits of the platform of Unacademy Plus. You will get the benefits of Prep Ladder, clinical and integrated essential session, dream notes taken by the dream team of Prep Ladder. Dream notes is provided to you. QBank 3 can be assessed with an active guidance system. Tags and more rapid revision snapshots and video lectures from the dream, recorded video lectures of the dream team of Prep Ladder. So what I suggest that if you are going to participate and take if you want to compete for NEET PG exam, next exam, so you should choose iconic subscription, because you are getting the benefits of live sessions of India's largest online teaching platform Unacademy. Along with it, you are also getting the benefits of recorded version, and dream team of Prep Ladder notes is provided to you. So these two benefits can be added on. So go for iconic subscription. Okay. Now my dear aspirants, I would also like to tell that batches starting on 25th August from is the various batches. Focus FMG batch is there, Target Next 2022 batch is there, NEET PG 21 emergency room MCQ batches are there. These are the updates of all the batches coming up. Join this, take the plus subscription, use my code and get 10% discount. Now 1 month package is there, and what are the benefits of NEET PG 1 month package? Ultra fast high yield revision batches, emergency room MCQ batches, NEET PG test analysis batches, last 3 year NEET PG previous year questions, COVID test and grand test series. So these are highly effective and important. So take 1 month of package and use my code for 10% discount. Now effective QBanks of the of this Unacademy platform is very important for you. As I told, in the iconic subscription you get the benefits of Prep Ladder also and plus subscription of Unacademy. But if you are going for this effective QBank of the Unacademy team, which is made by the top educators of Unacademy, you get more than 25,000 high yield clinical questions from all 19 subjects. Latest exam pattern पे ये सारे MCQs based है, and it includes detailed explanation from the top educators of Unacademy platform. Again, you can use my code NAD10 and get 10% discount. I would also like to share the grand test schedule with you. Do participate in this grand test. This will give you a better rank in your examination. I also want to tell you about 4-year subscription. So if you go for 4-year subscription, you get you either can go for plus subscription or you can go for prep ladder, and that is the iconic subscription. So this is highly useful for the first and second year students. They can target their examination. Along with it, they will get the target of next examination completed. So take 12 months of subscription and get 2 months of subscription absolutely free. I also want to tell you about the 1 month subscription and 1 month launch of the NEET PG, where it is just of 4,500 rupees and additional rupees 450 discount by using the code NAD10. At the end, I would like to and very proudly want to share the star learners who have cracked their entrance exam. Dr. Rosim Patel, Dr. Gayatri, Neha Singh, Dr. Anup, Deep Mohan, Dr. Subham, Dr. Pooja, Dr. Mukuvino, Dr. Siddharth, Dr. Arun Kumar, Dr. Eliza Philip, and Dr. Dipti Nishi. So they have cracked their entrance exam with FMG with a good rank and good score. So these are, I am very happy to share this. Now I also want to, they were all on the platform of Unacademy, and I am very proudly want to share their star learners also. Now I also want to at the end show you this slide. Why this slide? Because this is giving you the pricing detail of NEET PG subscription comparison with the plus and the iconic subscription. So this totally depends on you. If you are in first or second year, you can go for 4 or 3 years of subscription, and if you are in final or pre-final, you can go for 2 or 1 year of subscription. Use my code NAD10 to get 10% discount. All the best, keep studying. Thank you so much, and do join 6 PM and 7:30 evening session of free special session on the Unacademy platform. Thank you so much. All the best.